So let's continue with Chapter 3. This is Part 2, the rest of the lecture. And we're going to talk about combining forms related to colors. So chloro for green, chromo for color, cyano for blue, erythro for red, leuco for white, melano for black or dark, xantho for yellow. And some terms that you really need to know are chloroma, an abnormal mass of green cells, chromaturia, an abnormal coloration of the urine, cyanosis, blue discoloration of the skin or other tissues, erythrocyte, a red blood cell, leukocyte, a white blood cell, melanoma, characterized by a dark appearance, and xanthoderma, a yellow coloration of the skin. And let's talk now about medical records. A primary form of medical communication is the patient's medical record. In healthcare settings, medical terminology is used in both spoken and written communication. And the primary form of written communication is the patient's medical record. And because you'll likely encounter different types of medical records in your work, later chapters in the text frequently include medical records so that you can become familiar with the different formats and experience real-life uses of medical terminology. Some common types of medical records are hospital and clinical medical records, history and physical examinations, consent forms, healthcare provider patient care notes, laboratory and diagnostic test reports, and other specialty reports. And every week I'm going to put some example medical records pertaining to that chapter so you can practice reading. You may not understand all of the medical terminology, but as we build on your medical terminology knowledge, they will become easier and easier to read. So I strongly urge you to practice reading those. Just read through them once. You'll see that the years have X's in them. Just ignore that. That's just so you can put it in for any year. But just practice reading through those sample medical records. Before I advance to the other slide, let's talk a little bit about the hospital and clinic records. Those are sometimes simply called a patient's record, and they typically are a collection of all written documents related to a patient's examination, diagnosis, and care. The H&P is a record of the patient's past medical history, which may include forms from the patient fills out, the healthcare provider's examination of the patient. This is usually a standardized report because the examination is performed in a standard systematic record. Consent forms, those are signed by the patient to give permission for health care to be provided. They can include special forms for surgery and other procedures. The healthcare provider patient care notes, those are written into the patient record whenever a physician, nurse, dietitian, respiratory therapist, or any other healthcare provider gives the patient any form of care. And generally all diagnostic procedures and treatments are documented along with observations, test results, consultations with specialists, and so on. Laboratory and diagnostic test reports, these may come from sources outside the primary care team, such as a blood test result from an outside laboratory, or a pathology report, or from another department within the healthcare facility. And then other specialty reports include reports from other caregivers, such as a physical therapist or an anesthesiologist during surgery, and may include discharge reports when the patient leaves a hospital. So be sure to read through the sample medical records. And when you read it for the first time, don't stop to look up every new term you encounter. Instead, just read the record all the way through to gain a general sense of its meaning. And then you'll find it easier to understand specific terms once you're familiar with the overall context. And then if you're still unsure of some terms, you can look at your medical dictionary or look through the book. So let's talk about the body systems that are going to be included in this text. So remember, a body system is a group of organs with related structure or function. So, for example, the integumentary system is skin and its related structures. The digestive system is sometimes called the gastrointestinal system, the urinary system, cardiovascular and lymph systems, hearts and vessels, blood and immune system, the respiratory system, continue the male reproductive system, female reproductive system, nervous system, or the brain and the nerves, sensory system is eyes and the ears, a musculoskeletal system, the endocrine system, glands and hormones. Let's go back to those systems real quick. So human anatomy and disease are usually learned in relation to body system. So it helps to learn about different organs that work together within a related system, rather than simply study every organ by itself. And because many diseases also affect single body system, understanding health and healthcare by body system also make good sense. And much of medical terminology involves anatomy or healthcare by body system. So that also is why it makes good sense to learn medical terminology by body systems. And you're going to learn more about these medical specialties. Here we're going to talk about some of the medical specialties because many diseases involve primarily one system or one medical specialty may be a focus of a certain healthcare provider. So dermatologists study integumentary system or the skin, neurologists are specialists in the nervous system, orthopedists are specialists in the musculoskeletal system, endocrinologists are specialists in the endocrine system. So that's really the end of chapter 3. Be sure that you complete the chapter review, complete your prep view, read some sample medical records, and then when you're done with all of this, go ahead and take your practice quiz. Have a great evening.